As far as cavities, mainly what we see with cavities in between the teeth, we feel that a lot of times the cavities are caused by poor flossing technique or no flossing at all. We tend to see a lot of people that will readily admit that, I'll floss for a week and then I'll go 2 or 3 months and not floss, and then I'll think about it and I'll start doing it again. That's why we feel it's so important to start those techniques, to start those habits at an early age. I mean, if you can start those habits with a child when they're 2 or 3 years old, have them by the time they're 6 years old where they're actually doing that instinctively, as not even thinking about it. It's so easy because as they get older, it's an action that they've got ingrained and that they don't think twice about it. It's hard to kind of teach an old dog new tricks. So when you try to do that with older people, it's hard to make a change like that. I mean, the thing is and many times what happens is the patient, in many cases, after proper education on dental flossing and dental home care, the patient has some major procedure or some major dental problem, and a lot of times that is a good enough stimulus to change their behavior or their flossing habits or their brushing habits, and they're coming in on a routine basis to their dentist because they don't want to have to go through a problem maybe that they've gone through in the past by neglect or by not having some work done or not having their home care where it should be. So we tend to see with cavities in between the teeth, we tend to see that it's more of a problem of poor flossing technique. And then with cavities, what we see on other parts is basically not adhering to a strict toothbrushing policy where they're actually brushing 2 to 3 times a day. And we feel that's what's one of the major contributions to dental decay. Flossing is so important, especially for patients, for the adolescent years, for the early adult years, middle age to geriatric. Flossing is really one of the only effective ways that we at home can adequately clean the interproximal or in between the teeth and in the gum tissue areas, kind of what you don't see where the tooth goes, basically where the tissue comes up over the tooth. That it's so important because the flossing, what it does is the flossing disrupts the bacteria membrane that sets up, that can lead to periodontal disease, that can lead to decay, that can lead to all the different problems that can happen with teeth. So flossing is the most effective way interproximally to clean those surfaces of the teeth and to disrupt the bacteria's pattern for it to survive and for it to grow bigger and to cause responses.